Hi, I'm Dr. Kimberly Woodruff, the supervising physician at the Student Health Center. I'm here to speak to you about the tuberculosis screening requirement for all incoming students. First, a quick history lesson on tuberculosis and why screening is important. I know what you're thinking, an educational opportunity outside the classroom. This university is awesome. I'm totally getting my money's worth. So tuberculosis used to be common in the late 1800s and early 1900s. Its symptoms include fever, night sweats, coughing with blood, and severe weight loss. It used to be called consumption because it would actually consume its victims, and it was often fatal. Because of its contagiousness, people were often isolated to sanitariums to limit the spread of the disease. By the mid-1900s, medications were developed, so we started to get a hold on tuberculosis and limit its spread. However, this victory was short-lived. In the 80s, with the onset of the AIDS epidemic, tuberculosis took advantage of this immunocompromised population and started its comeback, especially in developing countries. This, along with multi-drug resistance and people traveling, has helped tuberculosis spread worldwide. Tuberculosis depends on people to propagate. So when you have a large number of people congregating in a small area, such as a university with residence halls, tuberculosis has the potential to spread. We want you to help us prevent that from happening by answering the tuberculosis screening questionnaire. Tuberculosis screening starts with 4 simple questions. These can be submitted online at the My San Diego portal or by the mandatory immunization form that you need to submit to the health center. Question 1. Have you ever had a positive tuberculosis skin test? This is an injection that is placed on the forearm to determine if you've been exposed to tuberculosis. It is considered positive if it is over 10 millimeters in size when it is read 2 to 3 days after placement. Question number 2. Have you ever had close contact with anyone who was sick with tuberculosis? When someone is diagnosed with tuberculosis, their close contacts are notified so that they can be tested for exposure and monitored for signs of illness. Question 3. Have you ever been vaccinated with BCG? BCG is a vaccine given to infants in countries with high rates of tuberculosis. It is not a routine vaccination in the United States. Question 4. Were you born or have you had significant travel in one or more of these countries listed below? Significant travel is defined as a stay for at least a week with substantial contact with the indigenous population. So for example, if you go to one of these countries and stay in a resort, most likely you're not being exposed to tuberculosis. However, if you go on a missionary trip, your chances of being exposed would probably be greater. If you answer no to all these questions, you're considered low risk for being exposed to tuberculosis. If you answered yes to any of these questions, you're considered high risk for tuberculosis exposure. This requires additional testing as outlined on your immunization form. Discuss this with your healthcare provider to assure that you receive the appropriate testing. If you have any questions, feel free to contact the Health Center at 619-260-4595. Or you can go to our website at www.sandiego.edu/health-center. The questionnaire and additional testing are required to be completed before moving into the residence halls. Please complete this as soon as possible. Waiting till the last minute will create a big headache on move-in day, and we want to prevent that from happening. See, we're already having a positive impact on your health, because that's what we do.